Bismillahirrahmanirrahim. Welcome, ladies and gentlemen. Imagine a single discovery that could transform the way we approach healthcare. Imagine an idea born in a university lab that eventually impact lives across the nation. Today, we gather to witness such ideas taking shape. Today, we gather not merely to present research, but to celebrate the spirit of scientific inquiry. We are here to witness ideas in their earliest yet most powerful form that have the potential to influence clinical practice, shape policy, and yet most importantly, improve lives. It's our honor to welcome His Excellency, the University President, Professor Fahid bin Ahmed Al-Harbi, Vice Presidents, Deans, and our distinguished guests to the first Applied Medical Research and Innovation Forum. This forum marks a milestone in advancing applied research, innovation, and multidisciplinary collaboration within healthcare. The Applied Medical Research and Innovation Forum aligns with the university's research strategic plan and with the national guidelines of Saudi Vision 2030, emphasizing research excellence, innovation capacity, and multidisciplinary collaboration within healthcare. Through scientific presentations, panel discussions, consultation sessions, workshops, and collaborative dialogue, this forum aims to encourage scientific inquiry, recognize excellence in research and innovation, and support the development of sustainable partnership that translate knowledge into real-world healthcare solutions. It's our pleasure to invite Dr. Saad Sadi, the Dean of the College of Applied Medical Sciences, to share his opening remarks and reflect the role of college in advancing applied medical research and fostering innovation.
بسم الله الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. سعادة الأستاذ الدكتور فهد بن أحمد الحربي رئيس الجامعة، سعادة الأستاذ الدكتورة جيهان بنت أحمد الحميدر نائبة الرئيس للبحث العلمي والابتكار، سعادة عمداء وعميدات الكليات والعمادات المساندة، الزملاء أعضاء هيئة التدريس، أبنائي وبنات الطلبة، ضيوفنا الكرام، السلام عليكم ورحمة الله وبركاته. يشرفني ويسعدني أن أرحب بكم جميعا في هذا المنتدى الأول للأبحاث والابتكارات الطبية التطبيقية الذي تعقده كلية العلوم الطبية التطبيقية. هذا المنتدى الذي نلتقي فيه اليوم تحت رعاية كريمة وحضور مشرف من سعادة رئيس الجامعة، وهو ما يعكس الدعم الكبير الذي توليه قيادتنا الرشيدة لمسيرة البحث العلمي والابتكار. إن هذا المنتدى يأتي تجسيدا حقيقيا لدور الجامعات الحديثة التي لم يقتصر دورها على التعليم فقط، بل امتد ليشتمل إنتاج المعرفة وتحويلها إلى تطبيقات عملية وحلول واقعية تسهم في خدمة المجتمع ودعم التنمية الوطنية المستدامة. إننا في كلية العلوم الطبية التطبيقية نؤمن بأن البحث التطبيقي والابتكار الصحي هما ركيزتان أساسيتان لتطوير القطاع الصحي وتحسين جودة الخدمات وتعزيز كفاءة الممارسات المهنية بما يتوافق مع مستهدفات الجامعة وخطتها الاستراتيجية للبحث العلمي والابتكار. لقد حرصت الكلية من خلال هذا المنتدى على توفير منصة علمية تجمع بين الباحثين وأعضاء هيئة التدريس والمبتكرين والطلبة لعرض تجاربهم البحثية ومشاريعهم الابتكارية وتبادل الخبرات وتحفيز ثقافة البحث المبكر والإبداع التطبيقي في التخصصات الصحية المختلفة. وإننا نأمل أن يكون هذا المنتدى نقطة انطلاق لسلسلة من الملتقيات العلمية النوعية التي تعزز مكانة الكلية البحثية وتسهم في بناء جيل قادر على التفكير النقدي والابتكار وربط المعرفة النظرية بالتطبيق العملي. وفي هذا المقام أتقدم بخالص الشكر والتقدير لسعادة رئيس الجامعة على دعمه المستمر ورعايته الكريمة لهذا المنتدى، كما أشكر اللجان المنظمة بقيادة سعادة الدكتورة لميا بنت خالد السيخان وكيلة الكلية للبحث العلمي والابتكار وأعضاء هيئة التدريس وجميع من أسهم في الإعداد والتنظيم وكذلك المشاركين بأبحاثهم وابتكاراتهم، وجزيل الشكر والعرفان للشركات الداعمة لهذا المنتدى الذي كان لدعمهم الأثر الكبير في انعقاده. ختاما أسأل الله أن يبارك هذا اللقاء وأن يخرج بتوصيات ومخرجات علمية مثمرة تعود بالنفع على جامعتنا ووطننا الغالي. I'm going to briefly say it in English, a few words. Your Excellency, the President of the University, Your Excellency, the Vice President for Scientific Research and Innovation, distinguished guests, esteemed colleagues, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. It is a great honor and privilege to welcome you to the first Applied Research and Innovation Forum of the College of Applied Medical Sciences, held under the gracious patronage and in the presence of His Excellency, the President of the University. This forum reflects the firm's commitment of the College to advancing applied research and fostering innovation and fundamental drivers for academic excellence, healthcare development, and social impact. Through this initiative, the College aims to strengthen the culture of research, encourage multidisciplinary collaboration, and support transformation of scientific knowledge into practical and sustainable solutions that's aligned with the university's strategic plan for research and innovation. On this distinguished occasion, I would like to express my sincere appreciation to His Excellency, the University President, for his continuous support and visionary leadership. I'm very thankful for the organizing committee led by Dr. Lamia Sekhan, the Vice Dean for Scientific Research and Innovation. I'm very grateful for the forum's participants and sponsors, whom without this event would it be possible. I wish this forum every success and look forward to its meaningful outcomes. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you so much, Dr. Saad. Now, we are delighted to invite Dr. Lamia Sekhan, Vice Dean for Scientific Research and Innovation at the College of Applied Medical Sciences and Chairperson for the Applied Medical Sciences and Research Innovation, to present her remarks outlining the vision, theme, and strategic objective for this forum.
His Excellency, the University President, Professor Fahad Al-Habbi, His Vice President, Professor Jihan Ahmed for Scientific Research and Innovation, Deans, distinguished guests, colleagues, faculty, and students. It's our honor to welcome you to the first Applied Medical Research and Innovation Forum. This forum represents a milestone in advancing applied research, innovation, and multidisciplinary collaboration in research, fully aligned with the IEU Research and Innovation Strategy 2025-2030. The theme of the first edition of this forum, Where Disciplines Meet, Shaping the Future of Healthcare, reflects our commitment to fostering collaboration across medicine, engineering, applied sciences, and industry. By bringing together diverse expertise, we aim to address real-world healthcare challenges and translate research into impactful solutions, supporting the university's strategic vision. The IEU Research and Innovation Strategy 2025-2030 places significant emphasis on health and wellness, which represents nearly 60% of the grand and frontier challenges, while the remaining priorities focus on energy and industrials, sustainability and essential needs, and economies of the future. Nearly 45% of these grand and frontier challenges incorporate artificial intelligence, highlighting its central role in advancing Saudi Arabia's digital transformation goal. This forum, with its focus on multidisciplinary healthcare research, innovation, and applied solution, directly contributes to achieving these strategic priorities. The core objective of this forum are to encourage students and faculty participation in research and innovation, to promote applied medical research that advances healthcare solutions, to recognize excellence in research and innovation by both students and faculty of the college, to foster multidisciplinary collaboration across healthcare and other scientific disciplines, to support networking and partnerships with institutions, industry, and partners, and ultimately, to build a sustainable culture of scientific inquiry with community impact. We are deeply grateful to our sponsors and partners whose generous support has made this forum possible and reinforces the university's mission to foster impactful research. I would also like to extend my sincere thanks to my organizing team, whose dedication, hard work, and vision have brought this forum to life. Throughout this forum, you will hear from distinguished speakers, participate in dynamic panel discussions, and connect with thought leaders who are driving multidisciplinary research and innovation across healthcare. We hope that this forum will serve as a platform for meaningful collaborations, innovative ideas, and actionable insights, advancing the university's strategic vision and ultimately shaping the future of healthcare in Saudi Arabia and beyond. On behalf of the organizing committee, I warmly welcome you all to the first edition of the Applied Medical Research and Innovation Forum, and I look forward to the exciting discussion ahead. Thank you.
Thank you so much, Dr. Lamia. We will now present a short video highlighting the college's research excellence in numbers. It's now our great pleasure to invite Professor Fahd Al-Harbi, President of the University, to officially inaugurate the first Applied Medical Research and Innovation Forum and its Posters exhibition.
At Imam Abdulrahman bin Faisal University, research inspires discovery and innovation shapes the future of healthcare. The Applied Medical Research and Innovation Forum serves as a dynamic platform bringing together students, researchers, clinicians, and industry partners to transform scientific ideas into real-world healthcare solutions. Across disciplines, ideas are explored, knowledge is exchanged, and collaboration turns research into real-world impact. From discovery to innovation, from collaboration to transformation, one vision shaping the future of healthcare.
His Excellency, the University President, Professor Fahd Al-Harbi, Vice Presidents for the Applied Medical Research and Innovation, Professor Jihan Al-Ahmed. The College of Applied Medical Sciences is pleased to announce the Shift Capacity Building Program, a strategic partnership between the College of Applied Medical Sciences, the Institute of Innovation and Entrepreneurship, and Siemens Healthineers, aimed at advancing innovation and capacity building in healthcare. For those interested in knowing or applying, please scan the QR code.
At this point, we would like to extend our sincere appreciation and recognition to our distinguished sponsors and partners, whose generous support and collaboration have played a vital role in the success of this forum. We are honored to invite the University President, Professor Fahd bin Ahmed Al-Harbi, College Dean, and Forum Chairperson, Dr. Lamia Sikhan, to kindly join us on the stage. Gold sponsor, the Mount Valley. Silver sponsor, John Hopkins Aramco Healthcare. الفيصلية Medical System. Salim Ahmed Bakhshan and Partners Training Company. Bronze sponsor, Abdurrahman Al-Qsaili, General Trading Company. Strategic partners, Danny Group. Siemens Healthineers. La Roche. Nadeem Media Team, College of Arts at Imam Abdurrahman bin Faisal University. Success Partners, an institution of innovation and entrepreneurship. Strategic partner, Art Suites. Strategic partner, Translation Medical Research Center. We would like to extend our sincere appreciation to all distinguished speakers for their remarkable contribution and for enriching this forum with their experts and insights. Keynote lecture speaker, Professor Abbas Salih Al-Tayyib. دكتور سعد السعدي. دكتور مساعد الزهراني. دكتور عبد العزيز المطلق. دكتور راسل هيلز. مودريتور دكتور لميا السيخان. The second panel discussion. Panelist, Professor Bert Williams. دكتور محمد براجة. دكتور جابر القحطاني. دكتور عاصم عبد القادر. مودريتور دكتور يوسف القرشي. workshop دكتور إسلام الدين. دكتور حياة المشقاب. Inventors بروفيسور علي الشامي. Dr. Omar al-Masri. Judges, Professor Rich Williams. Professor Abbas al-Mdayr. Dr. Jabir al-Qahtani. Professor Muhammad al-Hariri. Dr. Asim Abdelkader. Professor Ali Shami. Dr. Arun al-Amri, l'Amir. Dr. Jamil Saleh. Student Oral Presentation Moderator, Dr. Adnan al-Rimi.
Now, we would like to thank the University President, Professor Fahd al-Harbi, for being with us. We are delighted to invite the Vice President for Scientific Research and Innovation, Professor Jihan Ahmed. Deans, distinguished guests, faculty members,
and all the attendees to kindly proceed to the exhibition area to view the posters.
We now move to the first workshop titled Biomedical Startups from Research to Markets. This session will be delivered by Dr. Islam Addiq, Director of Innovation and Technology Transfer at Imam Abdurrahman bin Faisal University. This workshop, participants will be guided through the process of transformative academic research into market-ready biomedical startups with a focus on medtech and biotech development, market validation, and strategic partnership building.
ليش مايك متحرك ولا؟
إلا في دكتور هنا؟
طيب اوكي شكرا. السلام عليكم. Welcome back. I hope you enjoyed your lunch, but not as much. My name is Islam Addiq. I have recently joined IAU recently as Director of Innovation and Technology Transfer. And this is the Technology Transfer Office of the university under the Deanship of the Institute of Innovation and Entrepreneurship with the Vice Presidency of Research and Innovation. So I hope you can come closer because we want some interaction in this workshop. So the ladies behind, can you please come join us in the front? So in today's journey, we will learn about the medical innovation journey, startup creation, licensing your technology, about intellectual property protection for your inventions, and we will talk about some regulatory pathways and discuss a 12 to 24 month plan for innovation advancement. And you should be able to identify your next steps in translating your research into tangible impact. So I hope we will stick to the schedule. We are already behind. So we'll have 4 modules: the biomedical innovation journey, we will talk about the TRL, how to know your TRL, and the market landscaping, and the strategic decisions you take in the beginning of your commercialization journey. And the second module, we will talk about the different kinds of IP and protection that are relevant to biomedical innovations. And the third module, we will navigate quickly through the regulatory pathways through SFDA and other. And in module 4, we will discuss a roadmap and milestones you need to take care of in planning your commercialization journey. So let's talk about the big picture, the bench to bedside, and this is the innovative journey from the lab discovery to a real patient actually using your innovation. And here is a great insight many researchers don't appreciate. The scientific discovery alone doesn't change lives, but market delivery does. You could have the most publishable results and the most elegant experiments, but if you do not, if no patient actually uses your innovation, you haven't actually made success, you haven't made impact to society. So translating the research and scientific discoveries into tangible impact, into products and services that benefit the patients and the society at large is the aim of the commercialization and the success of innovation. So let us see the progression here. We have 5 critical stages of the innovation life cycle. Starting from the discovery, TRL 1 to 3. Here you have identified a problem, you have done some experiments in the lab, some testing, and you are in the world of proof of principle. You are proving the science behind the concept or the idea that you are testing. And unfortunately, most research is stuck in the discovery phase. And the journey ends for many researchers at TRL 1 to 3. So I would like just to ask you some few questions to know my audience. How many of you have patents? How many of you have patents? Okay, good. So how many of you know about TRL? What is TRL? Okay, good. So, in the discovery stage, it's all about science and research, but we need to move to further enhance our research. In the development stage, here is where it gets real. You are building a prototype, an actual work. You are doing clinical studies, testing on patients. Or preclinical testing, you are testing on animals. So at this stage, you should have an IP strategy. You should know what intellectual property you are having and how to protect this intellectual property. Because at this stage, you start to build the roadmap of your journey, of your commercialization journey. And think of it like building a house. In the discovery, you are in the blueprint. You're just seeing designs on the paper. And in the development stage, you are putting the foundation and frames of the building. In the validation, you are building the walls and the roofs of the house. And in the TRL 8 and 9, the advanced stage, let's say at TRL 8, you are visiting for like a weekend test. You test the shower, the kitchen. You see if you can live longer in this house. And then at the final stage, you move completely to live in this house, and you continue to test. Even when you're living, you test it in the summer, in the winter, in storms. So testing and seeking feedback, it's a continuous process through all the stages of the innovation journey. So in validation stage at TRL 6 and 7, so what is TRL? TRL, we will talk in details about TRL. TRL is the technology readiness level. How's your technology ready? scientifically, technically, and in the market landscape, how does it fit? So in the validation stage, you are testing the safety and efficacy of your innovation. You have pilot clinical trials, or you start to consult the regulatory authorities, the SFDA, and analyze your data. And after that, you move to the registration stage, in seeking approval. You submit your SFDA application and do some pivotal trials. And once you get the approval to launch, you move to the final stage, which is commercialization, market entry, or discussing deals with investors. You are putting plans for your startup, if it's a startup, and thinking about, and also you continue to get feedback from users, from patients, from hospitals using it. So here is a timeline reality check. This journey from discovery to market, to meaningful market penetration, it's a long journey. It takes from 5 to 15, or in some cases more than 15 years to actually reach the market. So this journey requires patience. It's a marathon, it's not a sprint. So for those of you who are thinking about commercializing their innovation through the different commercialization pathways, licensing, startups, or joint venture, you need to be aware of what you are signing up for. It's a long journey. It requires dedicated work, and it requires raising funds for millions and millions and hundreds of millions of reals. Technology readiness levels. The technology readiness level is the language that venture capitalists and investors and even government agencies, the funding agencies, understand. And whenever you communicate with any of those, they will ask you, what's your TRL? And if you know your TRL, how do you have a plan to advance your TRL? If you are a TRL 4 or 3, do you have a plan to make it to TRL 9? So the first thing you need to know is to know your TRL, to be able to assess your TRL, the readiness of your technology, and to have a plan of advancing this TRL to advanced stage, TRL 8 and 9, with concrete milestones along the plan. So at TRL 1 to 3, this is the basic research stage. You have a concept, you're doing some literature review, testing in the lab, generating initial data. So it's just on papers and some lab work. What action is required related to the commercialization journey at this stage? At this stage, you engage the TTO. The TTO is the Technology Transfer Office, the office of the university, which is responsible of protecting the intellectual property of the university and the researchers and faculty, and assessing the patentability of their innovations and helping them commercialize their innovation. So it's important for researchers to work alongside the TTO, to always communicate with the Technology Transfer Office, to disclose the invention, to discuss plans for commercialization. And the TTO's job is to help you. The TTO is a facilitator, is an enabler for researchers to help you and guide you through the journey. So moving to TRL 4 and 5, Zero. TRL 4 and 5 is the development stage. In the development stage, you are building a prototype or a minimum viable product, testing your design on a real model that can testing the functionality of your design, or you are doing preclinical studies to test the technical feasibility of your innovation. And at this stage, it's timely to discuss commercialization options with the Technology Transfer Office to see what you have, what options do you have for advancing the TRL of the innovation and the commercializability of the innovation. And at TRL 8 and 9, you are in the market. You have got the SFDA approval. You are working as a startup or working with an industry partner to commercialize your product, or and you are getting feedback from the users, the patients, the hospitals that are using your innovation. And through the journey, through advancing the TRL from one, when it was just a concept, to a TRL 9, which is a technology used in the market, you notice here in the technical risk drops, and the market and financial risk increases significantly at TRL 8 and 9. Why is this? Because think about it. At TRL 1 and 3, you are in the lab. What risks do you have? The only risk you have is, or the only question you are asking is whether this technology, whether this idea will work scientifically. And the answer to this question is simple, at no cost. Just some literature review and some lab work, you can test your idea. But when you move to TRL 8 and 9, you are in the market. On one wrong decision, and you have wasted millions and millions of Saudi riyals, and you have wasted years of work, of hard work and dedication. So the technical risk, we are de-risking as we move up the TRL ladder. We are de-risking technically, but the financial risk increases. So engaging the commercial partners at advanced stages is critical to take the right decisions. Okay, so when you are working in the lab and you are asking scientific questions, it's great to ask about the technicality and the science behind your concept. And from a scientific point of view, you are thinking as a researcher to how to prove the science behind your concept. But from the commercialization point of view, you need to ask three questions. Number one, is there a real clinical need, unmet need behind this problem? Not just is it a nice innovation to have, but are there a good patient population that will be using this to solve real problems? And so first question is there an unmet clinical need that is not addressed, and your solution will address it? The second question is your solution viable? Is your solution viable? Is it, does it have strong IP? Is the patent defensible? Which means, is it just an incremental improvement to an existing patent or innovation, or where just incremental improvements, the competitors and the big companies in the market can design around your patent, and they will not need you to license your patent? Or is it a breakthrough innovation? And what is your unique value proposition to the existing solution? Is it faster? Is it cheaper? Is it more effective? Does it integrate better in the workflow? So asking these questions, you also need to familiarize yourself with terms like TAM, SAM, and SOM. TAM is the total addressable market. How many patients actually having the problem? How many patients globally? And SAM is the serviceable addressable market. How many of those patients you could reach? Serviceable addressable market. And SOM is the serviceable obtainable market. How many of those patients you could reach over 5 years? When you ask these questions and define your SAM, your TAM, SAM, and SOM, you will be able to assess whether you are on the right path or not. Because let's see if you have, if the SOM is 50,000 patients, you could reach 50,000 patients who are suffering, for example, from diabetes and obesity, some cardiovascular diseases, some diseases and needs existing in Saudi Arabia and in the Gulf region. If you could reach 50,000 people to use your innovation over 5 years, this would be a big population. You could build a business around it, right? So in assessing the viability of your solution, we are lucky here at IEU that IEU now have a research and innovation agenda, which was developed in alignment with the national priorities of KSA and the priorities of Research, Development and Innovation Authority. So aligning your research with the innovation goals and the grand challenges that the university has set up will help you to assess whether your solution is viable or not. And the third question is the competitive analysis. How are you positioned in the market? Is there, who else is working on solutions like yours? Are you the only one, or you are among 5 people, 20 people, 50 people working on this? And where are you compared to others working on similar solutions? Are you 3 years behind or 5 years ahead? You need to position yourself in relation to, relative to your competitors. And if there are others working to develop similar solutions, how is your solution different? Is it cheaper? Is it faster? Is it, does it have stronger IP protection? Does it integrate better in the workflow in hospitals or clinics? So answering these questions, the 3 questions, is there an unmet clinical need? Is your solution viable? Is there a competitive advantage in the market for your solution? If the answer is yes for the 3 questions, you are on the right track. If you are uncertain about one answer or more than one answer to these questions, it's timely for you to engage your technology transfer office to discuss with them, to communicate what obstacles you are thinking about or you are having, what solutions they can offer you to navigate these obstacles and the innovation journey. So when planning the commercialization of innovation, there are three main pathways: licensing, startups, and joint venture. In licensing, you transfer the rights, the intellectual property rights, to an industry or a partner who will develop the invention and manufacture and sell. In exchange of licensing fees you receive as an inventor, and the university receives as an owner of the invention. And for licensing, so to compare licensing and spin out and know which path is right for you, there are many factors to consider. For, let's say, a pharmaceutical drug, which option is better? To license it to a big pharma company, or to build your own startup to manufacture this drug? I want this to be more interactive, so please participate with me. If you have a drug, which option you think is better? To build a startup to manufacture this drug and sell it, or to license to an existing pharma company? License. Okay, so you save a lot of time and effort, that's true. And there is also one extra advantage, which is manufacturing capability. Big pharma, they have existing manufacturing capability, they have existing sales channels and marketing channels you will leverage, which would take years, 20, you could take 20 or more years trying to raise funding for your startup. And if you decide that I will build a factory to manufacture this will take you more than 20 years, and you wouldn't be able to fund the necessary the necessary capital for manufacturing drug at larger scale. So where we okay. Yes, we will address this in the next slides. So, your question is very critical, Victor. You are asking about how to protect in case you are licensing. So, to license your innovation, it has to be first protected by a patent, right? So, if you have a patent, and who owns the patent? If you are an inventor, you have a patent registered in your name. Who owns the patent? The university, right. So what's in it for you financially? No. So if the university has the rights of the patents, what do you have as an inventor? Anyone? Okay, so let's differentiate between ownership and inventorship. The ownership, in patents, the patent document lists the inventor, the inventor and co-inventors, similar to authors and co-authors in journal publication. But what is different in a patent is the ownership. The ownership of the patent is for the applicant or the assignee, for where the applicant and inventor is different. The inventor discloses the invention to the university because you are working in the university, you are using the resources of the university, the labs, funding from the university or through the university from other organizations, but any intellectual property that is developed within the scope of your employment, or if you are a student, whether you are a student, faculty, researcher in the university, it is owned by the university. This is traditional and in research organizations and universities, and it is also governed by the IP policy of the university. The ownership is for the university. So in case of licensing, the university would be licensing the rights of commercialization to an industry partner or a pharma company. And in exchange of this, of granting the rights to manufacture, to sell to this, because the university owns the patent and owns all the rights, right? The patent is a legal document that gives or grants the owner an exclusive right to use, sell, and to use, make, and sell the invention. So you have the right as the owner. The university owns this right. To license this right, to grant this right to a company, it would be in exchange of licensing fees. Licensing fees could be in the form of a lump sum payment or annual payments, royalties, or royalties or payments linked to certain milestones. So there are different kinds of royalty arrangements. But the point is, the university would get money out of licensing the invention to a company, right? And the inventor, what does the inventor get? In the current IP policy of IEU, the inventor, there is a scale of share. The revenue is split between the inventor and the university. The split starts 30-70, 30 to the university, 70 to the inventor, 70% to the inventor, and as the revenue increases, the percentage of the university increases and the percentage of the researcher decreases until it reaches 30-70, 30 to inventor, 70 to the university, if the revenues are greater than 1 million riyals. So there are different scales for sharing, for splitting, but the point is the inventor gets a share of the revenue. Okay, and as the owner of the patent, the university decides whether to take the licensing path in consultation with the inventors. If the university, if the technology transfer office sees that the team working on this innovation is willing to go into the market and build a startup around the invention, they will help the inventors. Because at the end of the day, it doesn't matter whether you license or you build a startup or you co-develop the technology with an industry partner. The point is, what we target is reaching the market, right? The product or service you are developing reaches the market and the hospitals and patients. So the technology transfer office will take the right decision based on the facts and the data that they have and the discussion with the team and how the journey is clear in different paths. So there are many decision factors that govern this. We haven't talked about joint venture. Joint venture is where you co-develop the technology with an industry partner or a hospital or any partner or a research organization. So you both share the risk and share the benefits and revenues. It could be in the term of sharing equity or sharing joint IP, and both contribute financially to developing the innovation. through funding or through in-kind contribution by using the facilities or the infrastructure. So there are different arrangements for joint venture. But how would we decide which path is right for this technology, for a specific technology? It depends on many factors. First, the technology maturity. Where are you on the TRL scale? Are you in advanced stage, ready to hit the market, or it still needs development, further development and TRL advancement? So first step is to assess the technology readiness level and write the plan that you will work on for moving from TRL 1, 2, 3 to TRL 8 and 9, and defining the milestones and the technical and financial requirements needed for advancing the TRL. Second is to assess the market size. The market size is an important factor. How large is the market? And how could you reach this market? Whether it is a small, medium, or large market, how could you be able to develop your technology so that you can reach and have a portion of this market? And also financial needs are important decision factor, because if you require 100 million riyals to develop a drug, is different than if it's just a platform, an AI solution, or a small device that doesn't require much manufacturing capabilities to advance. So the capital required, the technical complexity of the manufacturing needed for drugs is different than devices, different than diagnostics. So all have variations in terms of the requirements and the time also needed to reach the market. The shortest time to market is through licensing, because once you license the technology for a big company, they will take care of the regulations. They have relationship with the regulatory authorities. They have marketing and sales channels. So they will, and the manufacturing capability, you could be able to scale the technology from for example, drug. If it's a drug from grams to mass production in kilograms and distribution. So it could reach the market quickly. For startups, it could take up to 15 years. And for joint ventures, it is the middle point where both partners develop the technology. And also an important factor is the founder commitment. The founder, the inventors of this technology are willing to commit time and work to develop this technology, or they are just they want to license it and move to the next research question and do extra innovations. So this is an important factor also. And the risk profile depends on also assessing the market. And so who helps you take this decision as an inventor? The Technology Transfer Office. I will keep repeating this. You need to negotiate to engage the Technology Transfer Office with you, because our job is to facilitate and enable your journey. So this is a local example of licensing at King Abdulaziz University. King Abdulaziz University developed pharmaceutical patents owned by the university. So the university licensed the patents to a local medicines factory. Of course, the commercial terms and the names are not available due to confidentiality obligations. But why did they choose to license this technology? Because, as we said, faster time to market and leveraging existing manufacturing capability of the factory, and no or very low capital required, because just grant the right, and once the product generates revenue, the university will get a share of the revenue and the inventors will get a share of the revenue, but there is no much spending in the early stages. And so for the takeaway from this example is that for innovations that require heavy manufacturing, the licensing is the best option. An example of the spin out, Nanopalm, it's a biotech spin out from Caxt, founded in 2022. So they identified a problem, which is inefficient delivery of genetic and RNA-based therapies, which leads to poor tissue targeting and high toxicity risks. They found the solution and they built a startup to commercialize this technology. So for this solution, it was the best option to spin out, to build a startup, because being a platform technology, it requires less fund, less manufacturing capabilities, and some dedicated team focus. And for platform technologies also, it's easy to attract investment and to attract teams to work with you. Raising capital wouldn't be as difficult as for more complex technologies in the pharmaceuticals or diagnostics. The third example is for co-development, a joint venture between King Faisal Specialist Hospital and Research Center and germ-free labs. They found this, they announced this in Bio 2025 in Boston, and the hospital is co-developing this technology with a global company, germ-free labs, and they have put a plan to reach to deployment in 18 months. So in this model of collaboration, they both share the risk and share funds, and they will both share the benefits when this generates revenues. So this is a perfect model for university technologies that require both expertise. So the university has the expertise, the people developing the technology and further enhancing it, but they require some maybe technical or manufacturing complexity or different expertise, someone with biomedical, with biomedical or health related experience who needs some IT experts or AI development experts. So both institutions, both teams work together and co-develop the technology to be able to commercialize it. So this is where the joint venture is the right and best decision and best path to take. So at the end of this module, the key takeaways is that bench to bedside is a marathon, not a sprint. If you are planning for your commercialization journey, plan for 15 years, 5 to 15 years, depending on your technology, on your solution, and the complexity of advancing it. And patience is very much needed in this throughout this journey. TRLs matter. Know where you are on the TRL scale. Know at which TRL you are, and have a plan to advance your TRL. Because whenever you are communicating with any person outside academia, whether VC or investors or industry partners or funding agency, they will ask you about TRL. You need to be prepared to answer. Market landscape is your compass. Study the market, do some preliminary market analysis, use the resources available in the university, the technology transfer office, the different centers that we have, that the Translational Medical Research Center. They will help you in navigating the regulatory requirements and the financial requirements and the available funding resources. Choose your path strategically, and alignment is critical for success. Alignment with the innovation goals of the university, alignment with the national priorities, research priorities of the kingdom, alignment with the market needs and the available funding and sources for advancing the innovation. So before we move to the next module, I want to see if anyone has any questions or comments with regard to TRL and commercialization pathways. You see, if you don't ask me, I will ask you. Okay, I have a question. Are all patents commercializable? If you have a patent, does it mean that you will be able to commercialize it, since there are different paths for commercialization, licensing, startups, joint development? So if you have a patent, does it mean that this patent can reach the market? Anyone? It doesn't mean, because actually most of the patents, 70 to 90% of the patents don't reach the market, especially in academic and research institutions. The majority of the patents that reach the market are owned by industrial companies, because they patent only the commercializable innovations. They do the IP assessment, the commercialization assessment before they patent, so that when they patent, because a patent is costly, it costs thousands, tens of thousands of dollars. So before they invest, they need to be sure that they will have a return on their investment. So the second module, we will talk about IP and making use of the technology transfer office of the university. So here is a great insight. IP is not a legal nicety. It is your competitive moat and funding catalyst. It is your protection shield. You need to be protected before you publish your research. So there are different types of patents, different types of IP. The types that are relevant to biomedical innovations are patents, copyright, trade secret, trademarks, if there is a brand. So what are patents? Patent is a legal document that grants the owner the right, the exclusive right, to make, use, and sell the invention. And exclusivity matters. Exclusivity very much matters in the market, because once you have this exclusive right, you are the only person who can make and produce this invention, and you are the only person who can grant this right to a different person or different entity. So this is what makes patents critical for protecting the innovation. Because if you think about it, if you don't have a patent, you don't have any right. I know that in academia and research organizations, researchers tend to publish first, and then maybe later they would think, oh, it's nice to have a patent out of this research. So they disclose the invention, they disclose the research after they have published. And this makes many many great innovations prevent them from going actually into a market, because they lose value. Without a patent, without legal protection of your invention, you lose the value. You will not be attractive for investors and for venture capitalists. No one will be willing to invest in your innovation. Because if anyone can do it, why would I be committed to work with you? I can do it myself. You already published everything. You published the data. You published the process, the formulation. So I can do it. I can use my manufacturing capability to do it. Or if I am ethical enough and honest to give you the credit as an inventor and work and collaborate with you, what prevents other competitors from doing it themselves and competing with me? So why would I be committed to work with you? So the duration of the patent protection is 20 years, and they cost tens of thousands of US dollars and Saudi riyals. Trade secrets are a different aspect of IP. Trade secrets is simply to keep your innovation secret, and also it lost protection. So you patent if you can, so to be able to publish your innovation and prevent others from doing it. But you keep a secret if you are able to protect it as a secret. If it is, for example, let's think about a manufacturing a process for drug formulation. So you may do both. You may patent the drug formulation and keep the manufacturing process secret. And how to protect this secrecy? It is minimal cost, because you only need to sign NDAs, non-disclosure agreements, and NDAs are a strong legal commitment to keep your invention secret. And also maybe you need to train your employees or your faculty or your colleagues to keep the technology confidential. So some training may be needed, which is low cost. You may need cybersecurity arrangements if it's related to data protection. So what differentiates trade secrets is it can be at low cost, unlike patents which are costly. But trade secrets are not actually common in academia, because researchers want to publish at the end of the day. They want to publish, they tell the world about their discovery. So in academia, the more common methods for protection are patents and maybe copyright. If it's software code, if it's a user interface for an application, or also for documentation. So copyright protection is automatic. You don't need to register. You don't need to register the copyright. It is good, it would be helpful in case of dispute or legislation that you have a copyright registered in your name, but it is not required. It is automatic protection. Once it's published, once you publish, you get automatic protection. What's the duration? The duration is for the author's life plus 50 years, and in some countries 70 years. Here in Saudi Arabia, it's for 50 years after the death of the author. So it is a lower cost than the patents, and the duration is for trademarks. Trademarks is for brand protection, to protect the brand, the logos, the designs, product name. Maybe you have a test, you can brand this test. You can give it a name and brand it. And duration for trademarks is 10 years from registration, and it can be renewable indefinitely. You can renew as long as you pay the fees and you are actually using the trademark, so you can have indefinite protection. It is common for product or company names and brands and logos. For software, there is a distinction. For software, algorithm can be patented, but the actual code you wrote, the Python code or the code that you wrote, this is copyrighted automatically. So you can patent the algorithm and have a copyright for the code. So here's why you need to consult your technology transfer office. We will assess your protection, the required protection, the available protection for your technology. We will guide you to prepare the required documents, to patent, whether to copyright, to trademark, or if at a later stage, or you are forming a startup and you need trademark registration for the brand, for the logos, for any, or we can advise you to keep it trade secret if needed. So please communicate with us in the technology transfer office, and let us help you protect your innovation. So when we speak about startups, why IP protection is essential for startups? So we have two scenarios here. One scenario, a startup with IP and a startup without IP. For a strong IP, if you have a strong IP protection, you have confidence in the competitive advantage. You have the exclusive right, and you can charge premium licensing fees for others to use this right, or you can secure funding for your startup because you have the exclusive right and for the strong IP. And the market size, the exclusive rights means high royalty fees, which it doesn't make sense if you don't have strong IP, or so if you don't have exclusivity. It doesn't make sense to charge royalty fees or to license your innovation, or to attract funders to give you capital money required for advancing your startup. So the patent portfolio attracts venture capitalists, attracts investors, attracts partners. And with a weak IP, it's very difficult, and it would mean nothing to raise capital. The patents also prevent others from copying your invention. So it is because as it is important to know that for startups, it takes much longer time to reach the market. For big companies, it's much easier because they have the capacity to advance any technology towards market quickly. But for startups, you need to have exclusivity to prevent others from reaching to the market faster than you. And so the bottom line is strong IP is the difference between a fundable startup, a startup that can attract funding, and an unfundable startup. So you have an invention. What to do as a university researcher, as a professor, as a student, as a postdoc, graduate student. First, you need to contact your technology transfer office. Contact us. We will guide you through the disclosure process. There are disclosure forms available on the website of IEU, and what we will do is when we receive your invention disclosures, in the invention disclosures, it's like 10-page document. You answer a few questions. You list the inventors and co-inventors and which funding source you used, and some simple questions, and you identify what the problem and your solution and how it works and what are the key advantages of other solutions in the market, and you will be able to also define the TRL, and we will have this discussion together. And once we answer these questions and we have a description of your invention, we will assess the protection of your IP and also assess the commercialization potential of this technology. And we will discuss together how to advance it to TRL 8 and 9 and reach. And we will discuss also whether this could be licensed, whether it could be suitable for startup, or whether we could develop it jointly with another organization, be it a company or a research organization. So the important point that I want to say here is that disclosure is important. The university owns the IP. The university protects your rights in the IP. And there are many cases where university faculty did not commercialize their inventions because or due to late disclosure. They disclosed, but they disclosed later after the publication. Because the new direction that we are taking in IEU now is to file patents in Saudi Arabia. Saudi Arabia is one of the few countries that require absolute novelty of the patent application, of the invention to be patentable. So if you publish before you file a patent, your patent application would be rejected in Saudi Arabia. It is unlike the US. The US Patent Office has a grace period of 1 year after publication. This is not available in Saudi Arabia. So what market are you targeting? You are in Saudi Arabia, you want to build a startup in Saudi Arabia, so you want to protect in the Saudi market. If you don't have a Saudi patent registered in the Saudi Patent Office, the Saudi Authority of Intellectual Property, you will not have protection in the Saudi market. You will not be able to establish a startup in Saudi. So file a patent, submit invention disclosure first to be able to protect by a patent before publication. The second point is to understand your university IP policy. The IP policy of IEU is available on the website. You can just Google simply IEU IP policy, and you will find the IP policy document in Arabic and in English, in both languages. And go through the IP policy. Familiarize yourself with ownership and inventor rights. What are the percentage of split? What are the requirements to disclose? When you are cooperating with an industry partner or an external organization, be it a hospital or clinic or research organization or funding or government organization, how can you protect the IP, and how can you involve the Technology Transfer Office to negotiate agreements on your behalf to protect the rights of your invention. Confidentiality requirements. How to protect the confidentiality of your invention so that it doesn't go public before you protect it. The assessment process. What support is available. I can tell you now what we are doing right now is we are updating the IP policy of the university, and we are updating the procedures of and the processes of the Technology Transfer Office, so that the IP policy, the current IP policy of IEU is good as it is as a legal document, but we want to make it more inventor friendly. We are working